Hello, friends. Uh, it's evening time in this part of the world. It's about it's 10:30. 10:30 p.m. Hmm? Indian Standard Time 22:30. I'm just going back to what I'm used to doing. I'll be describing. There is no end of this problems in all people and the problems of people. Like the illness. There are plenty of topics. So today I'll be talking about one. It's actually a major thing. I left it out. I should have done it a little earlier before doing some of the things which I did, like gastrointestinal disease I did. So before that I should have done this one because actually it's quite an important topic in the sense that of the 3 or 4 causes of mortality in the world, according to WHO, the 4th common cause of mortality is lack of what they call exercise or physical exertion or physical therapy. Uh, of course, everybody knows the first 1, 2, 3 is hypertension, this one heart disease or hypertension, smoking, diabetes. But a 4th common cause of disability in the world, or disease in the world, is lack of exercise. Why does it happen? Why is it in an epidemic proportion in the world? It is because of the urbanization in the whole world now, especially after second half of the 20th century. The whole thing, everything has become mechanized. Everything has become mechanized actually. You get a machine for everything. For example, for your housework, everything is mechanized. You have this thing, this mixies and what they call mixie. Then you got this, even dishwashers are nowadays popular. So many things are there. So you don't have to draw water anymore. Everything is piped water. Piped water is supplied by the nation state itself in many places. And if you don't have to climb stairs, you don't have to climb stairs anymore. There's something called lift. I call it like it looks fancifully like a coffin, lift. So each time you go up that, remember, one nail is put on the coffin. Okay. So the level of urbanization is rampant, and it is throughout the world, and so that's why people have become like animals, sitting down animals. They are no longer moving animals; they are sitting down animals, and many of our work is sitting down. We sit down. An office worker sits down at his table. Then a driver sits on his wheel. Don't think driving is an energy expending activity. Driving is a sedentary activity. Driving, office work. Even people like me, clinicians who see patients, you have to do a lot of sitting. for 5 hours of sitting. But reduce your if you have to get some benefit out of this thing, exercise therapy, reduce your sitting time also. Try to reduce it as much as possible. Make it 3 hours. Okay, if you can reduce it further, better. And not sleeping time always is there. That's separate. I'm talking about other time. So physical activity, inactivity is there. Then there's another thing. So what can you do about it? Especially those who are aging, they should have an active physical activity program. active physical activity. It is better if you join a group. If you join a, there are two types of activity. For the activity itself, there are two types. One is called aerobic activity. In aerobic activity, as the name suggests, you take in a lot of air when you are doing this exercise. So what is it that exercise is? When you are walking and running, you breathe more. You don't have to breathe like in this one yoga. You have to don't have to do a conscious breathing. It becomes rather automatic. When you are running, your breathing the activity goes up. So what happens in breathing is the physiology of physiology of aerobic activities. You will be pumping out more blood. Your lungs will work at more capacity, so it will take more oxygen. So it can actually be measured. It's called VO2 max. V is the volume of blood ejected, and O2 is the arteriovenous oxygen difference. That means there is a lot of difference. You have consumed a lot of oxygen. So that can be. It's called VO2 max. There is another thing. There's another thing also. But that is called MET, metabolic equivalent of task. But when you are doing aerobic, you can measure how much oxygen you are expending, and what is the cardiac output, how much blood is coming out of the heart. That is VO2 max. Other one is called metabolic equivalent task. When you are doing something, if you are doing nothing also, there is a metabolic equivalent. It's called 1:1. When you are sitting down, the metabolic equivalent of task is 1. That is equal to, if you are sitting down for 1 minute, you will be spending 1 milli equivalent of energy per kilogram. So that is what is 1 met. So if you are walking, it's called moderate exercise. It will be 3 METs. And vigorous exercise or rigorous exercise, it will be a 6 or more. 6 MET will be 6. So that way you can actually say, I spend so much of energy, and the people can measure your VO2 also. So, but VO2, I said, as you age, the VO2 VO2 max can come down a little bit, because because of changes in your muscle and your pumping capacity of the heart, it can come down a little bit. But the MET is almost equal. If you are even if you are young, old, and all that, if you are walking, you have to spend that much of energy. 3 MET you have to spend. If you are doing running, the 6. So that way also you can say that I spend so much of energy. So that is one way. So what is recommended by the World Health Organization is that you should have at least 150 minutes of moderate activity. That is 3 METs. 3 METs per minute. This one metabolic equivalent of task. Metabolic equivalent of task. So if your task is little moderate, you will spend about 3 METs per minute. So I should have 150 minutes of moderate exercise per week. Per week means it can be stretched over days. So 7 days. You need not do every day. You can do it 3 or 4 days a week. So you can say you can do about 30 minutes per day, or you can do 30 minutes per day will be a lot of exercise. That will be 30 minutes per day means how much? That will be 7 by 3.5 hours. You don't have to do that much. Sorry. 30 minutes into 7, 280 minutes. I'm sorry. 30 minutes into 7 is 210 minutes. Here, what they recommend is just 150 minutes. 150 minutes is about 40 minutes every other day is enough. 40 minutes every other day is enough. And that is for aerobic activity. Then it has to be a multi-component exercise. Multi-component exercise, there is aerobic itself may not be enough to give you good health. Because when you are doing just aerobic exercise, what it does to the body is aerobic, of course, gives more oxygen, and also it will metabolize more of sugar, so it can prevent diabetes from being for. Even if you are diabetic, it can bring down the diabetes. But if you want to have, for example, there are diseases which cause fatigue. There are diseases which cause muscle wasting. And when you become old, you become a little frail, and your balance will also go. You have to have muscle strength. So that can be got not by aerobic alone. You have to have what's called some amount of resistance training also. Resistance training means you're putting a resistance against your muscle contraction. That's what meant by resistance training. When you're, for example, when I flex this one hand, you put a resistance against it. So most of the time what we do is you carry a weight and you try to lift it. Well, lifting is a kind of resistance. It's called resistance exercise, lifting. The same thing can be done with a hand, leg also. But you can do it without weight also, like sitting, sit-ups, sit down, get up, sit down, get up. They are called sit-ups, or do a push-up with the hand. They are all resistance training or resistance exercise. Ideally, when you are old, you should have this resistance exercise first before taking up the aerobic. At least a few minutes of maybe 10 minutes every day. 10 minutes, 15 minutes every day. And ideally you should join a gym, a gymnasium where people go and there is a physical trainer for you. I don't know how much money the physical trainer will take from you. It may not be, people who are pensioners may not be able to afford the fees. But you sacrifice some amount of your money for that. Then you can do it on your own till you get initially you get a physical trainer for 4 or 5 months. Then, I also joined a gym, but what I did was I didn't get a physical trainer. So they will come, you do this. What you have to know how to lift up, at what angle, all those things, how to do the squat properly. Somebody has to be the trainer. So always get a physical. If you are joining this thing, I'm just telling you from my experience. If you are joining a gym, always get a physical trainer. Give some money, doesn't matter. For 5 months you give money, then you will learn these things. Then you can start practicing at home also. You need not go to a gym. So why physical resistance training is important is, when you are doing this resistance training, especially resistance has 2 aspects, One is you are lifting up the weight. It is a flexion. They have some other name for it. It's called, concentric. The muscle contracts concentrically, like that, flexion. Extension is eccentric. Eccentric. So these are 2 different types of exercise, concentric and eccentric. When you are doing more, especially eccentric exercise, what happens is there will be small fractures in the muscle. The fracture in the muscle will stimulate the muscle to hypertrophy, to become bigger. One thing. Another thing is, there are small factories in our cells, especially muscle cells. That's called microsomes. And that will also proliferate. And the third one is the protein in the muscle will become more. The protein in the muscle is generally called that's called myosin. It is found by experiment that by somebody found out that there's some entity called infant myosin. That level goes up when you are doing resistance training. So there is a good backup of randomized controlled trials which has shown all these things, that the real buildup of muscles happen and it becomes clinically beneficial in people having. So this is exercise therapy, especially the resistance training and the aerobic. Aerobic for there are two domains actually. One is the physical, just the physical. This I can't call it anaerobic, but it is resistance training. The resistance training gives you more muscles. What happens during aerobic exertion or exercise is that the stuff in your brain that becomes more plastic. It's called neuroplasticity. There are certain elements in the brain which are produced more. What hormone? It's not a hormone. Yeah, but some brain chemical is produced more. So that leads to neuroplasticity. And blood supply to the brain goes more. So the cognitive decline will be less. So your chance of getting dementia, loss of memory, or the thing is called Alzheimer's disease, kind of dementia, goes down when you're doing this aerobic activity. And when you're doing the resistance exercise, as I said, the muscle buildup is there. So the frailty can come down. You may not, those who cannot walk because their thigh muscles are weak. When you strengthen the muscles, you can walk. You may not fall. So it prevents falling. It's a great thing. It prevents falling. So these two aspects are there. Prevents cognitive decline. Then if you have disease, if you got even suppose a debilitating disease like HIV, you have to have muscle build up. Otherwise you waste. It's called wasting disease, slim disease, called slim disease. So for slim disease, there is no other treatment other than doing a resistance training, slim disease. So you take cardiac rehabilitation. If you have heart attack, you have to have exercise. If you have cancer, after chemotherapy. If you want to come back to your normal thing, you should have exercise, regular exercise. Both aerobic resistance, but if those who are a lot sick may not be able to take up aerobic immediately, but resistance exercise is possible. Physiotherapists, other caregivers can also help them do it. So this is what I want to give you a message, that sitting down or sedentary habit is a disease. It's the fourth common cause of illness, disability, disease in the world. So always be on the move, please. And those who are by profession have to be sedentary. You try to reduce your downtime or sedentary time. Somehow you have to reduce it to 3 hours or 4 hours. Then if you are a teacher, for example, you don't have to sit. You can walk and take a class. So a doctor, try to be on your feet, standing most of the time. So this is my short message, and thank you very much for your listening. And I hope there will be some queries and questions. Please do send me some message. Thank you very much.